Video in. It's dark outside, but I'm trying to get it in while I got some light for you. Real quick on fitness, health. Yesterday I mentioned that I recently had surgery, and I want to talk a little bit about why, but also this might help some people out there. If you have chronic sinusitis or you have sinus infections all the time, you might be in the same boat that I was in. So let me describe it to you. Since I was little, um, I really didn't get sick much. The only times I would get sick, it would almost always be a sinus infection. But as I got older, these sinus infections started to become like super resistant to medicine and super resistant to antibiotics and resistant to everything. And so my sinus infections would last longer and longer and longer. Instead of being a week, it would be 2 weeks, 3 weeks, 4 weeks, then a month, 2 months, 3 months. I've had sinus infections last almost 6 months at a time. This last one went from August 20th until I had surgery November 22nd. So, 4 doctors. Let me talk about the doctors real quick. I went to urgent care clinics. I went to emergency rooms, and they don't treat you. They don't diagnose you. They don't know what's going on with you. So they just say, 20 people came to me this week and they had this, you probably have that. And so here's a script. Go to the pharmacy, take that, and see if it works. It wasn't until I talked with the 4th doctor that the 4th doctor was like, yeah, I don't know what it is. So I'll give you a referral to a ENT specialist, ear, nose, and throat. Thank God they did, finally, because when I went to the ENT specialist, they scanned my head. They did a 360-degree scan of my head. They were able to look at all my soft tissues in my face, and they were able to see into my sinus cavities and my nose. And what they found is I had a broken nose. I don't know when I broke my nose. I could have broken it when I was a kid, fighting or messing around with sports or whatever. But I didn't know I had a broken nose. And so I had a bone that was blocking my left side. It's called a deviated septum when it's blocked like that. So not only did they find that I had a broken nose and the bone was blocking that side, but they also found that I had 2 huge cavities, sinus cavities in my face, kind of behind my eyes, that were full of mucus, which is why I had all the head pressure and I had the constant headache for months. And the infection wouldn't go away because the little cilia inside that's supposed to move the mucus out, they were pretty much dead or paralyzed due to the infection being in my body for so long and so many different antibiotics and steroids being used and not working. So the cilia weren't moving the mucus out because it started to calcify and harden. And so basically, the doctor gave me another round of antibiotics and steroids, said, let's see if this works in the next 2 weeks. If it doesn't work, then surgery might be an option. So I talked to some people that have had that surgery. Surgery, in my book, is an option of last resort. I'm not interested in having surgeries. However, in this case, I'm also not interested in staying sick, staying in pain, and having all this junk in my head that won't come out. So the antibiotics didn't work, the steroids didn't work, and so I went ahead and I had the surgery. They went in through my nose, they removed some bone, they removed some cartilage, and they sucked out a bunch of mucus that was stuck in my head that wasn't coming out. I feel way better, I can breathe way better, and more importantly, going forward in the future, I'm way, way, way less susceptible to those sinus infections that linger on and on and on and on and on. Doesn't mean I can't get sick. It doesn't mean I can't get sinus infections, but I'm not going to have them like before, that's for sure. So if you have sinus infections like I had that drag on for weeks or months, go see an ENT specialist, ear, nose, and throat specialist. Get a referral from your doctor and go see the specialist. That way they can look inside your tissues in your head and they can see what's going on to properly diagnose why it's not going away. I highly recommend it. I don't recommend surgery. But I highly recommend going to see your ENT specialist, because if surgery is what you need in that case, trust me, it's worth having. It's like a 2-week recovery, but I'm so glad that I had it. It sounds weird to say I'm glad I had a surgery, but trust me, I'm glad that I had that surgery because I feel way better. So if you have that issue, go see a specialist.